Well, we had, as I've said, undertaken the study in people with cystic fibrosis, but it was not completely going to answer the question regarding airflow obstruction. And we then looked at a group of people with asthma. And these were people admitted to the high dependency unit at the Brompton Hospital with an exacerbation of asthma. They entered the study at the time when their cough became productive sputum, because it's inappropriate to begin physiotherapy when the airways are so constricted that nothing is moving. So it was when their cough became productive of sputum. There was no evidence of any increase in airflow obstruction in the arm where huffing and breathing control was used when it was compared with conventional physiotherapy without huffing. There was a trend towards increased efficiency in the clearance of secretions, but this was not significant. But the main point was that there was no evidence of any increase in airflow obstruction. This work we were able to present at national and international conferences. When I say this work, the work with people with cystic fibrosis and the work with people with asthma. And because it had been done in the name of the Brompton Hospital, the rest of New Zealand and the United Kingdom and Australia then started to follow and began to use huffing and breathing control as an important component of airway clearance, important and effective. Barbara Webber and I spent many nights trying to decide what to call what we were doing. It would have been difficult, it would have been good, but it would have been difficult to have called it the Thompson technique because it was sort of within postural drainage. And we finally concluded that if we called it forced expiration, the forced expiration technique, we would be emphasizing, so we hoped, that it was a technique using forced expiration, not just huffing or forced expiration on its own. We had some success with this, but as with the Thompsons, we too were misinterpreted. And there was a big study a few years later which took place in Canada by Dr. Reisman and his team in people with cystic fibrosis. And they took children and had two groups. One continued with conventional physiotherapy and one had huffing in sitting, but with no emphasis on breathing control. They were followed for 3 months, and unsurprisingly, those who had huffing only in sitting lost lung function. Those who continued with conventional postural drainage improved their lung function. This study they called the forced expiration technique, and it was only the following year at an international conference at which Barbara and I were present that and when Dr. Reisman presented his work, that we were able to question what he had done in terms of the forced expiration technique and to highlight that it was not the forced expiration technique which had been used. He had thought his physiotherapists were doing it correctly, but realized they weren't. By this stage, his paper had been published and under the name of the forced expiration technique, and that meant that throughout Canada, for some years, any study applying for ethical approval and including the forced expiration technique was not passed. So again, there were problems in getting a very effective treatment across to people in many countries. But we gradually worked our way through that one, and further studies were being undertaken which added or increased the evidence for the support of this particular technique.